All right, so let's talk about the mobile segment, or what's sometimes referred to as the functional spinal unit. With the mobile segment and the spine itself, we're dealing typically with three parts. So if you look at this diagram on the right, this could be at the cervical, thoracic, or lumbar segment. Generally, it does not refer to the coccyx segment. Lumbar, thoracic, and cervical are going to be most common, but it's going to include three different components. So as I look at, and these aren't labeled here, but as I look at this segment, you're going to have the superior vertebrae right up there. Then you're going to have the disc in the middle, and then you're going to have the inferior vertebrae. So those three together make the mobile segment. So let's just say for this purpose this is L3 and this is L4. This is going to be the disc between L3 and L4, so we don't call it the L3 or the L4, it's the L3-4 disc. And this would be called the L3 hyphen L4. Sometimes people use a slash in there, but this is going to be the L3-4 segment. So that's what we're trying to use for terminology. And as you look at different things, we're going to say there's a disc herniation at the L3-4. Or there's some issue with movement at 3-4. These are common abbreviations we're going to use, and in documentation we're going to say there's hypomobility or hypermobility or some anatomical change at 3-4. But that's referring to the mobile segment. With this, it's talking essentially about these inner body joints. So the joints that occur between the superior and inferior, either vertebral body, it could be, or the superior and inferior facet joints. Depends on what we're talking about. But for the most part, you're going to notice that with this, there are 6 degrees, which is significantly more than most joints, like the shoulder or the hip. We refer to them as having 3 degrees of freedom. So we're looking at motions that occur with 6 degrees of freedom. And that's generally because this intervertebral disc creates a different dynamic that can cause the vertebrae to move in different directions. So with that being said, our vertebral column, do you think it's designed for mobility or stability? Well, you would think, oh, this has 6 degrees of freedom, so that's going to go towards mobility. But actually, it's not correct. Our vertebral column is designed more for stability, which is why it's able to go in so many different directions. It's more able to absorb shock and distribute loads and forces in different directions, so it is absolutely trying to provide a lot of stability. That being said, there are clearly different areas that have more or less stability. So when we think about the sacrum with fused vertebrae, that's going to have inherently much more stability than a mobility focused of the spine looking at C1 and C2, where there isn't this disc. There's the dens or odontoid process, so there's a lot of movement, especially with rotation. So at that joint, it's definitely leaning more towards a mobility component as opposed to a stability component. Here's a visualization of what the different movements will look like. So it'd be good just to look at this and to visualize the terminology: shear, anterior, posterior, medial, lateral, flexion, extension, the planes they go in, and so forth. So that's one way to visualize or understand how the segments within the spine move. Another way is to look at this diagram here to see that, well, so there's the disc, and you can see the lines within the disc and how there's movement here. So you have side to side sliding, gliding, or translation, however you want to phrase that. So that's here. Now you have some distraction, so you got this vertebrae going this way and presumably this vertebrae going that way, so they're going apart. So they're coming apart from one another, distraction from each other now, which is similar to, if you look at D, you have tilting, and which is going to compose of a distraction component on one side with a compression component on the other side, and that's what makes the vertebral disc be able to provide these different degrees of freedom that the shoulder or the other joints don't necessarily have. You have this sliding, which is like this sliding over here, but instead of going medial lateral, you have it going anterior and posterior. So you have that type of sliding that's occurring. And then with E, you have this rotation. So this is going to be going in the transverse plane. So if this superior vertebrae is rotating, and it's hard to visualize since this is two-dimensional, but if this top vertebrae were twisting, almost like a bottle cap or a lid would twist on the jar or the container, that's what this would look like. And then certainly there's also this last one, there's tilting in the anterior to posterior direction, which is like tilting here. So you get a compression on one side and then a distraction on the other side, which would occur with flexion, for example. Another way to look at that with relation to the disc, and this is from your textbook, these are representations theoretically of what a disc material, a low density gel water type material would do when you take dense things such as the vertebral bodies, which are quite dense in nature, and then you take relatively non-dense things, but this depends on the age. We know that with time and aging these do become more dense, and water escapes from them, as you know from previous lectures. So with this, with movement, you can see how that disc might distribute the load more evenly across the vertebrae. The one thing I'll point out, and this is from the textbook, I just don't like this representation because it doesn't apply functionally as much. So this picture I think is a better representation about what happens with tilting. This picture is correct in the textbook, but it's more of a theoretical. If you take an object and its lower density and put it between two other objects, this is essentially what would happen. But the thing that's difficult about this is it makes it look like whenever you were to tilt or side bend to one side, you'd have this bulge of the disc that occurs naturally in this manner. But because the nucleus is in the middle and there's all these annular rings, which are much more dense and collagenous in nature, we don't get this quite bulge in shape. So I do think this picture, although theoretically it's correct, it is a little misleading to think about how this happens within the body. If anything, we get more of a protrusion or a bulge on the opposite side, which you can sort of see in this picture here, although it's difficult. So I just mentioned that to be aware of. This is more theoretical and this is more functional in terms of what happens with a disc and the annulus. One of the other structures besides the vertebral bodies occurs at these intervertebral joints. That's where the inferior and superior vertebrae will articulate. And at those articulations, just like other joints in our body, whenever we have articulations, we need something to cushion those articulations. While the discs themselves, the IBDs, are fibrocartilage, the xipophyseal joints, or sometimes they're called Z joints, most commonly we call them as facet joints. Clinically, that's the easiest thing to say, and that's usually what we say. These facet joints are lined with an articular or hyaline cartilage. So it's a very thin, dense amount of cartilage that will wear down over time, but it helps to distribute some of the load. But as you can imagine, you could look at how big, let me get a different color for this. You could look at how big the vertebral body would be and how much load, if you can imagine load coming down through the axial skeleton, how much load is distributed there versus how much load is distributed on the facet joints. The vertebral bodies will accept a lot more of the load. It depends on the situation and the mechanics. Generally speaking, we think that about 70%, 75% of the load is transmitted through the vertebral body, and 30, maybe 25% is transmitted through these facet joints. And that's in a neutral resting position. However, you can imagine with different mechanics, at place, that load may shift. So in this example right here, you could see that if I bend forwards, a lot more of the vertebral load is occurring, especially the anterior vertebral load. Whereas these facet joints are becoming further apart, they're becoming distracted, so a lot less load is occurring in this case. Or in this image, you can see that load is transferred on this side versus this side through the facet joints. So that's going to be important to consider patient presentations and how they might affect or implicate certain facet joints or certain intervertebral disc patterns with everything that's going on. But these are synovial fluid filled joints. They do have joint capsules, so there could be a capsular pattern. When we talk about the capsular pattern of the spine, we are referring to these joints in particular, these facet joints. And we'll talk in class about the orientation of all these facet joints. But they are articular cartilage lined, and they can degrade and degenerate over time. Now, as we look at the planes of movement, like most parts of our body, it's not an exact plane, but it's really close to one plane or another. So you could see the facet joint planes, they do change over time throughout the different levels. So at the upper cervical, it's not completely horizontal, but it's really close to horizontal, which would mean it operates primarily in this transverse plane. And as you go further down, and so let's say we get to the lumbar spine, if you could picture this, they're almost vertical in nature. So at the lumbar spine, if you have this vertical plane in nature, this is going to operate along the sagittal plane. So if it's this orientation, it's going to be associated with flexion and extension. So it's in that sagittal plane around an axis that is relatively horizontal in nature, and we'll go through some of that further. But make sure to look through this and understand that these facet joints change. Look at the skeletons, look at the different facet joints at the different levels, and see how they change over time. So this is something I think would really help to visualize and look at prior to coming to class. Here's another representation, and you can see the intervertebral bodies here, the discs, and how you have that IBD and that segment that's created by these. So this is also referred to as the interbody joint, because it's taking this vertebral body and this vertebral body, and it's connecting those bodies. So interbody joint, and that's why we often refer to it as the intervertebral disc, between two vertebrae. Contrast that with, you have your lumbar or facet xipophyseal joints there. You can see much thinner or smaller in nature, and you can see here as another representation of that. So if you look at this, which motion will lengthen these capsules? You could probably tell here that if I take the spine and I move it, let's say, into this direction, which would be flexion, I'm going to distribute the load more onto the disc and away from the facet joints. Consequently, extension is going to load both facet joints. And then in class, we'll go over some examples of this. But if I bend to the right, the lumbar spine, it's going to generally load or approximate the right facet joint. If I bend to the left, side bend to the left, left lateral flexion, that's going to load the left facet joint.